and born again child of the Most High King.
Good afternoon. Welcome to Family Health Matters. I'm your host, Wendy Bridgers, and we are live in the studio on Awesome Radio 106.9 FM. We are here every Thursday from 3 to 3:30 on Family Health Matters because we know that the health of our families matter. So excited that you're joining with us via Facebook, cable network, YouTube, and Awesome Radio Station. We are so glad that you have tuned in with us. We invite you to join us every Thursday again from 3 to 3:30 on Awesome Radio. I am so excited to have my friend and colleague with me today here on the radio broadcast, Dr. Sharona Johnson. She's going to be sharing with us, and we're going to be talking about kidney disease. I know we've been so focused on COVID-19 and so many other different things going on, but I wanted to bring this back to the forefront of our conversation and our thoughts because this is what we sometimes consider kidney disease as a silent killer. People don't know that they have it until they have some additional issues, or to the point that I don't want to say no return, but their kidneys are so damaged. So welcome, Dr. Johnson, to
Thank
Family
you,
Health Matters. I'm so glad you could be here out of your busy schedule. So thank you for joining us. Tell us a little bit about yourself and why you are considered a specialist to talk about talk about kidney disease on today.
So I work with a nephrology group in town, ECU, Hypertension and Nephrology. And we work very closely with people who have kidney disease, and from the beginning stages until late stages when they're on dialysis. And I think I've been doing that for close to maybe 20 years. And so I work very closely with the nephrologist, and I usually see most of my patients when they're entering at least what we'll talk about later, the end stages of kidney disease, prior to thinking about what their options are.
Okay, great. So that sort of clarifies why you sit at the table on today. Okay, kidney disease. Tell us what kidney disease is, and tell us a little bit about how it sort of affects us, and just talk about kidney disease for the beginning, and make sure you tell us what a nephrologist is as well.
That's a good point. So you'll hear the words renal, kidney, and they really mean the same thing. And nephrologists are just specialists that deal only with kidney disease. And so kidney disease is just simply what it says, any disease or anything that affects your kidneys adversely in a way that causes them not to function as well as they do. And I know a lot of my patients, and a lot of people will say, well, I still urinate or I still make water, and so there can't be anything wrong with my kidneys. But usually people who have kidney disease still can produce urine or go to the bathroom. It just means their kidneys aren't cleaning their blood and getting rid of the impurities in their systems as well. So it's really anything that affects the kidneys that make them not clear or clean your blood as well as they should.
I like the way you said that about cleaning your blood, because that's like you said, the purpose of the kidney is to clean out all of those impurities that goes through there. So it sort of flushes out. But I said that because when we talk a little bit later on about people who may have chronic kidney problems, or trying to figure out what can they do with after they've had kidney damage, the importance of having something or some type of procedure or something that's going to help do what the kidney does. Okay, so now that we know what the kidney does and what it is, what kidney, so the kidney disease. So now what we talked to, you also said a little bit about what my next question was going to be about what the kidney does. So it does clean out and infiltrates or take away the bad things that shouldn't be there. Okay, so what's the difference between, I've heard people say, and I know this, but just for our audience, people say, acute kidney disease and chronic kidney disease when they hear the doctor say this. So elaborate on that. Tell us about the difference.
So I think the simplest way to explain it is acute is something that is temporary, something that happens suddenly, and usually is easily resolved. So if I'm an athlete and I'm running in the summer and I get dehydrated, then I might have some acute kidney injury because I'm dehydrated and my kidneys didn't get enough fluid or blood. And so the kidneys may suffer an injury. So I describe that to my patients as if I were running and an athlete and I hurt my ankle. Well, my ankle's going to heal. It may not be as strong as it was, but it's something that's kind of sudden. And it happened and I can kind of get it fixed and taken care of. Chronic is more, according to the guidelines that we have, chronic has to be kidney injury or damage greater than 3 months or greater. So if I'm someone that has had high blood pressure and my kidneys have over a 3-month period shown that there's some disease or damage, then they're going to put me in the category of chronic because that's not easily resolved. And I'm probably not going to go back to what we consider our baseline. I'm going to have some degree of damage that's going to remain with my kidneys.
Okay, great. So tell us some things that can cause acute. And you gave us an example of an athlete that's running, but what can some things that, because I've had some patients or some young people who have said that the doctor has said I had acute kidney disease.
Yeah. So dehydration is one of the things we see quite commonly. Severe things that can cause acute are things like being in a traumatic accident and having blood loss or things that affect your kidneys during that accident. Other ones are urinary tract infections can affect them, especially if you have a lot of those. And I think any type of injury immediately to your kidney can lead to that.
Okay, can lead to the acute part. And you mentioned earlier that you said that that's something that can be corrected.
Correct. And usually with acute kidney injury, you get it treated. It can go back to what we call your baseline. So everything's back to normal.
Okay, good. So that's something we know that we can fix if we fix this. So tell us a little bit about chronic then. How does that work?
Well, chronic's a little, like I said, so our guidelines or the things that we use, kidney guidelines, and it says any kidney injury or disease 3 months or greater is considered chronic. And so chronic disease usually comes from things like diabetes is the number 1 in the United States, and hypertension is number 2. And so I think our focus basically probably should center on that, because the other things are people who are born with one kidney or people who have hereditary diseases or injuries that, are things that they're born with. There are some people that have, chronic infections of the kidneys. I can use a lot of words like polycystic kidney disease. There's a lot of different things, but the main things that affect most people in the United States are diabetes and hypertension.
Okay, that causes the chronic part. And this is just a little bit, and I just thought about this while I was talking. So when you have a patient that's, and this is asking this for family members of patients who may be in the ICU, the intensive care unit, and through their sickness, the doctor has said that there's damage to kidneys. Now, is that considered acute or chronic if they never had any? And I know it depends a lot on the symptoms and everything that goes along. Yeah. But how would you help somebody to process that? If that's a good question.
I think the important question for somebody who had that situation, you would definitely be seeing a kidney specialist who would be a nephrologist. And the question I think I would ask is this something that I'm expecting mom or whoever to have long-term, or is this something that can be resolved with this hospitalization?
Okay. All right. That's good, because some people don't know the question to ask. And that's why we're doing this today, so that we can help our families ask the appropriate things. Good answer. Good clarification. So tell us a little bit about the statistics and some basic facts or complications associated with kidney disease.
Okay. I know currently right now in America, there's about 37 million people that have kidney disease. And of that 37 million, there's probably about, usually it's about 800,000 or so that have what we call end-stage renal disease or kidney disease. And those are people where your kidneys really are not functioning to the capacity that's compatible with life for very long. And these people are, out of that 800,000, if you took that, about 600,000 of those people are on dialysis, and probably about 300 or 250,000 have transplants. And that allows them to live pretty decent life and carry on with their families and do things they enjoy. I can tell you that, like I said, the number 1 and 2 causes are diabetes and hypertension that lead people to be what we call end-stage renal disease. And that's when you have to make a choice about dialysis, transplant, or some people don't make a choice. And we can talk about that later as well. For Black Americans, unfortunately, we're 3 to 4. I mean, we are at least 3 to 4 times more likely to have kidney disease than our white counterparts. And also, we see high numbers in Native Americans as well as Asian Americans.
Well, the flip question gonna go back to why. Why is that? Why would you think that with the numbers so high in African Americans?
Well, some are hereditary factors. Some diseases are specific. We have a higher incident of those diseases in African Americans. So one is FSGS, which is a focal glomerulosclerosis. It's kind of like Alonzo Mourning, who was a basketball player, had. And so we see this in families sometimes. And also hypertension is very common. And as well as diabetes. And some of it is access to care, and some is understanding exactly, uncontrolled hypertension can lead to this over time. And if you're not taking your medicines, you don't have good access to care, if you don't understand the end organ damage is what we say, that can occur from that, then, I think we see that very common in our culture.
Okay. All righty. So that goes back to, which could be a whole nother show when we talk about the importance of managing your hypertension or managing your diabetes, because of complication that goes along with that could be the end stage renal disease.
Yeah, because, if you take 5 Americans, that have high blood pressure, 1 in 5 of those would have probably kidney disease, and they may not know it.
I guess that goes back to what people say, hypertension is a silent killer. So that's one thing, because you don't know, you don't feel bad. And that's one of the questions that we were going to ask earlier. How would you know if you had chronic kidney disease? But we'll save that one so we won't forget to go back to it.
Well, Wendy, the other thing is that, so that's for hypertension, but 1 in 3 people who have diabetes also probably have kidney disease as well.
So not trying to get off track, but how
always get off track.
I know I do, but this is what we're doing, a discussion. Okay. But so what do you do with that? If you say that I have diabetes or I have hypertension, then I won't say probably have, but I could possibly have kidney disease.
Correct.
So what do I do?
So if you know that you have those disease processes, if you're aware, like you said, hypertension is known as the silent killer, but if you're having your regular checkups, or even if you have a blood pressure cuff at home and you know that your blood pressure stays above 120/80, that it's higher than it should be. If you're having your checkups with your primary care doctor or provider, it's important for them to test your kidney function. There are tests specifically to measure your kidney function, as well as have them do a urinalysis on you. And in the urinalysis, they are looking for protein in your urine. And if you have the test, we call it creatinine, or they're testing and look at your levels. If that's elevated and also you have protein in your urine, those are factors right there for your physician to be aware that you have some aspect of kidney disease or damage.
So with that, if we are going and going to our primary care provider on a regular basis, so those are things that they should be doing for us anyway, or should we tell people that they need to be asking about these things?
So usually if you go to your provider, if you're having a physical or an exam, most of them will draw the blood to test or look at your kidney function. It's part of a general panel of blood work that you probably get. What we don't always do specifically is test your urine for protein or blood or things that would indicate that. And I think that's important to, at least, if you don't have it done every year, at least have it done, every other year, to make sure that your kidneys are not are filtering as well as they should be. And we can help tell that. I can go more in depth, but if you have protein in your urine, that's kind of a independent factor for kidney disease. So that means just protein by itself in your urine probably tells you there's some kidney disease.
That there is something, because that protein should not be there.
Correct.
Because the body should be filtering that, should be using that
Right.
instead of filtering it out.
Yeah, explain it to my patients like a strainer.
Mhm.
There's certain things that should go through the hose of that strainer when you're straining different things or food. And then there's certain things that should not.
Right.
And protein is one of the things that should not go through that strainer.
Okay. Kids, is there any way in discussion? Is there any way that you can just look at your urine? I know the answer, but is there any way that you can just look at your urine and be able to tell that you have kidney disease or there's something going on with your kidneys?
So I've had patients come in and say, "Yeah, my urine is clear, it's yellow, it looks good." And no, the answer is no. You can't look at it and make that determination. Just like you can't determine that if you make urine or if you go pee, that you don't have kidney disease.
Right.
It's really not that simple.
Okay, it goes back to the follow-up and the importance of access to care.
Correct.
So if you're out there and you're not getting those annual checkups, you need to be getting those annual checkups, because these are some things that you may not detect or until symptoms start.
Right. And that's usually when symptoms start, that's a little late.
Yeah. And I think that goes back to when people talk about hypertension and they say, I feel great, don't feel bad or anything. But then when the blood pressure is up, then they start having the headaches, the dizziness, the possibility, signs and symptoms of a stroke. And it may not be the fact that your blood pressure or your diabetes or whatever was just all of a sudden just shot up. It's not going to have those same effects. Correct. But it's been chronic. That's been going on for a while. Okay, good. Okay, so let's talk about, I think you talked a little bit about the facts, the basic facts, but anything you want to jump out there, it's complications with kidney disease.
I guess I could tell you what the literature tells us is that just having chronic kidney disease, and you heard me say independent factor, or just by having chronic kidney disease, you're at risk for heart disease. Rather that is a heart attack or your heart not functioning correctly. How that connection is, I'm not always certain. I mean, I have some theories, and as our literature has theories, but we know that if you have chronic kidney disease, you're probably at risk for heart disease.
Okay. So that comes before the heart disease, the chronic kidney disease, or does not necessarily?
It can be the chicken or the egg, but yes, they both lead to the other.
Oh, okay.
Yes.
Okay. Can both.
Yeah.
So somebody who has diabetes, who has hypertension, possibility of kidney disease could necessarily have cardiovascular disease.
Yes.
Also.
Yeah. They all just play very well together.
Okay. Which we don't want them to.
Right.
We wouldn't want them to play in the sandbox at all, but they do. So tell us some more about some basic facts.
So we talked a little bit about who's at risk. And I guess the only other thing I just like to mention about the basic facts is that 9 out of 10 people with kidney disease are not aware that they have it.
Yeah.
And I think that is an astronomical number.
Yeah. And that's really very unfortunate, because once they realize, as we said earlier, then you start seeing symptoms, and then it's hard to reverse what's going on.
And I think that's what I see a lot in my clinic is people who come in, and I mentioned I do the late stages, and they present and they're like, I feel fine, but my primary care doctor referred me to your clinic, and they say something's wrong with my kidneys. Or, I mean, I have people who show up and it's time for them to really make a decision about dialysis. And I just think psychologically, that's really hard for them to hear when they didn't even know they had any aspect of kidney disease.
That can be really hardening. Yeah. So I was reading with some of the facts that kidney disease is one of the top 10 causes of death in the United States. Compared to cancer and breast cancer, prostate cancer. So it's really high up there as far as something that could cause death. Correct.
And you just got to think about like I said, the downstream effects, like the cardiac disease. It also puts people at risk for stroke. There's a lot of things that our kidneys do that we're not aware of. Like some of my patients come in and they're very anemic. And I've heard people, down here in Eastern North Carolina say low blood, but they're very anemic. And that also can stress your heart out, make you feel very fatigued. And also low anemia levels can cause a lot of problems over time as well. Your kidneys affect your bone structure, so it interrupts your calcium and phosphorus balance. So I have a lot of older patients, and they don't really have to be older if they have kidney disease, who can fall, and you can easily have fractures. So the kidneys are very, they just do a whole lot for us to maintain a balance. They clean your blood. And we usually try to use medications or dialysis or some other form if we have to try to maintain what the kidneys do. And we never can take over perfectly what our organs do for us.
Right. Those little pea-shaped things are really, really big in your body. They're small, but they do a lot.
And that's a good point, Wendy, just for basics. When you said pea-shaped things, so they're usually the size of your fist, and they're in kind of the flank or the back area of your back, one on both sides. For people who are not quite aware of where they are.
Yeah. And when people complain of back pain, and they say sometimes it's back pain, but you have to think about where your location of the kidneys are, because so that could be a flag there that it's not necessarily maybe your back that's hurting, but it could be something that's going on, an infection or something that's going on in your kidney. So you can't ignore those pains. And I know this is another little sidebar really quickly. Tell us about, people are always taking ibuprofen, Advil, excuse me, and Tylenol. Tell us a little bit about that. And so I'm sorry.
You left out BC powders, because they do those again. So those are called NSAIDs. And so Tylenol take out of the equation. Because Tylenol is not one of those. And we recommend Tylenol for many of our patients who have pain or if they have to have aches or something like that. So anything in moderation is not usually bad, but if people take BC powders, Advil, Motrin, those kind of things on a consistent basis, they have to be very, very careful, because those can lead to kidney disease. And actually they are able to, we have some people who are on dialysis who have had, I have truckers who were like, I just took these every day, all the time. My back was always hurting. I had no idea that this medication could hurt my kidneys. And so again, I want to stress that anything in moderation is okay, but you do have to be very careful with those things, as well as when you go in the hospital, if you have to have contrast dye studies. The contrast dye is something that can lead to kidney disease, especially if you already have some aspect of it. It can kind of make it worse. So usually we give you the risk and benefits of those kind of things. And the other things are antibiotics or aminoglycosides, or a type of antibiotics that can also affect your kidney. So it's very important when you're taking medicines, or you go in for hospital procedures, or you're like over-the-counter medicines, like, if you think you're just buying an Advil or BC powder, you wouldn't think that it could have long-term implications, but they can.
Right. Those are very good, because I know people that just take them on a routine basis every day, and they're young, and they think, I'm fine. But then it's the long period of time of
it's
that
a cumulative effect.
Yeah. So that's good. Very good information. And I think too, when you mentioned the contrast dye, that when the nurses or the doctors or whoever tells you that you need to drink fluids, and this is going back to the hospital, and they say, you need to drink because you're flushing out your kidneys. That's literally, that's what they mean, is you need to drink. So you can't just say, well, I drank a glass of water. So you need to drink, as they say, because you don't want to damage your kidneys.
That's correct.
Okay. Very good. Good information. See, we stand on track. I'm doing good. Okay. So just a few questions that somebody may ask. The doctors, just questions that I pulled that may be some frequent asked questions. Okay. We talked a little bit, and I think one of the questions was, how would I know if I had kidney disease?
Yeah, so you would have to go to your primary care doctor and get the appropriate test. You can't. You won't know. It's very silent until it get to the end stages, and then the end stages, you may have things like, my legs are swollen, or I have edema, I'm short of breath, I'm very fatigued, I don't feel well, I don't want to eat, food doesn't taste right to me. I mean, all those things are signs of what we call uremia, and that's where the kidneys have just not functioned as they should, and they're not filtering your blood.
Okay. Back this question now. I go to the bathroom frequently. Does that mean that my kidneys are working good, or do I may have some problems anyway?
So that's kind of a twofold question. The answer is you may still have some problems, but being able to go to the bathroom and actually urinate, the mortality for somebody that can still urinate, especially if they're on dialysis, your mortality rate decreases. So it's a good thing if you can maintain urine. I know it's odd. I mean, my mom was on dialysis and she got to the point where people on dialysis get to the point sometimes where they don't make urine anymore, and they find it strange that their body doesn't produce any urine. It doesn't have to, because the dialysis machine is doing all the work for you. So going to the bathroom is a good thing, but it does not mean that you do not have kidney disease.
Right. Okay, good. All right. So next one. What are some symptoms of kidney disease?
Kind of the ones that, like I said, I mentioned earlier. By the time you start have symptoms, you really are in the late stages. The things that come up about are, like I said, people come in with swelling in both their legs. They're short of breath. They notice that they're short of breath with exertion. I usually walk to my mailbox, and now I can't because I get short of breath and I have to take a break. Anemia is one of the things they experience. They're cold all the time. They always want a blanket. And that's a sign of anemia, but that can be from kidney disease as well. So those are some of the basics. I ask people, how many pillows do you sleep with at night? And the reason I ask that is because I want to know when they lay down, are they short of breath? Because the fluid shifts in your body. And sometimes when people lay down, they'll get short of breath. And a lot of people experience kidney damage, or they find out they need dialysis when they go to bed and they lay down and they can't breathe. And then they go to the hospital and realize that, their kidneys have failed.
Okay. So one last question, and then I'm going to ask you to just tell us some basic things that you think we need to do for ourselves to help us either prevent kidney disease or help us manage our kidney disease. Okay. Does high blood pressure necessarily mean that I have kidney disease?
No, it does not necessarily mean you have it. And we'll talk about that when you give me the time to say how to manage your kidney disease.
This is your time to how to manage kidney. You have 3 seconds.
3 seconds. Okay.
No, you have about 4 or 5.
So keep your primary care appointments with your provider. Manage your hypertension, because it's not high blood pressure, it's uncontrolled hypertension.
Okay.
So blood pressure that is not controlled. So I tell people, take your medicine, follow up with your physician, check your blood pressures. Diabetes, it's not diabetes, it's uncontrolled diabetes.
Okay.
So for people that have diabetes, A1Cs that are high need to be controlled. Those are some of the top things.
Thank you so much, Dr. Johnson, for being here. And we, again, are here on Family Health Matters, Awesome Radio 106.9 FM. And I'm your host, Wendy Bridges.
Awesome Radio.
Partial funding for this program is brought to you by CT Cleaning Service, 919-345-5823.